Things that you can do to reduce your cancer risk. So in addition to having regular physical exams and the appropriate screening test, you want to avoid tobacco use, try to increase your daily physical activity, of course, make healthy food choices, protect yourself from the sun, know your family history, because that's important. We'll talk about that in specifics in a few minutes. Limit your alcohol and maintain a healthy weight. So cancer doesn't affect all ethnic groups the same. So I just want to share a few facts about Asian Americans and cancer. So Asian Americans generally have lower cancer rates than the non-Hispanic white population. However, should you be diagnosed with cancer, it is the leading cause of death for this population. Among men, the three leading causes of cancer death would be lung, liver, and colorectal, with liver cancer death is 60% higher in Asian Americans than Caucasians. And among women, the three leading causes of cancer, oops, I'm so sorry, and I can't see the rest of my screen, that's my problem here, but it should be breast, lung, and colorectal. I have to change my view for just a second to get, there we go. All right, sorry about that. So we're going to talk about breast cancer screening first. So 1 in 8 women, or about 12%, will develop invasive breast cancer over the course of their lifetime. And breast cancer rates increase almost 6-fold for Asian American women. Breast cancer is the second leading cause of cancer death in women, with only lung cancer causing more. And we estimate in 2021, over 280,000 new cases of invasive breast cancer will be diagnosed in the United States alone, with nearly 50,000 new cases of what they call carcinoma in situ, which is where the tumor is isolated and can be surgically removed. Although it's rare, men can get breast cancer as well. 2,600 new cases of breast cancer in men are estimated for this year in 2021. So the screening recommendations for breast cancer, the average risk woman, you should discuss with your physician starting annual mammography beginning at age 40. And screening should continue as long as your life expectancy is at least 10 years. Now, if you have a personal or family history of breast cancer, dense breast, or you just have questions in general about your risk status, and you could potentially qualify for high risk earlier screenings, talk to your physician. And then there's a website link here. You can see, if you want to write this down, that there's a health risk assessment on the henryford.com website that you can do. Answer a few questions about your personal and family health, and it will calculate your risk of breast cancer over your lifetime. You should also have a clinical breast exam with your physician every 3 years for women in their 20s and 30s, and then every year women at age 40 and older. And beyond regular screening, it's important that if you noticed any changes to your breast, that you'd want to report that to your physicians. And mammograms are available at several Henry Ford locations, and you can see the picture here on the right. We also have our mobile mammography bus. Here's a listing of the coach locations on the left-hand side. We do come to areas near you. Now with COVID, we did have to put our bus on hold for a while, but over this past fall and again this spring, we're getting the bus out and about in the community again. So most locations will have what they call state-of-the-art 3D tomosynthesis. It reduces false positives that mammograms can give, and it's more accurate than just what they call a 2D picture of mammogram. The next cancer we're going to talk about for women is cervical cancer screening. Cervical cancer is frequently diagnosed in women between the ages of 35 and 44, with the average age being 50. Each year, approximately 14,000 women in the United States will get cervical cancer. Cervical cancer is actually 5 times greater in Vietnamese American women than in your non-Hispanic white women. Cervical cancer was once one of the most common causes in cancer death for American women. The death rate has dropped significantly with increased use of the Pap test, which is the way that they screen for cervical cancer. The human papillomavirus, or HPV, is the main cause of cervical cancer. HPV is a common virus that is passed from one person to another during sex. Most sexually active people will have HPV at some point in their lives, but few women will ever get cervical cancer. But the thing to note is that female cancers usually cause no symptoms, or they show vague symptoms until the cancer has progressed to an advanced stage. This is why screening is especially important. The screening guidelines for cervical cancer, women ages 21 to 39 every 3 years. And then there's a little overlap, women ages 30 to 65 every 5 years, where you're getting both the Pap test and a human papilloma or HPV screen. So schedule your visit with your primary care physician or your GYN physician to get this screening. Specific to men is prostate cancer screening. Prostate cancer is the most commonly diagnosed cancer and the 5th leading cause of cancer death in Asian American men, but it can often be treated successfully. Your lifetime risk is 1 in 9 to be diagnosed with prostate cancer. Prostate cancer remains an important cause of cancer mortality in men because there'll be just over 34,000 deaths per year as a result of prostate cancer. It's the 2nd leading cause of male deaths behind lung cancer. Prostate cancer is more likely to develop in older men and in African American men. There's about 6 in 10 cases in men who are 65 and older, and it's really rare in men under age 40. But you want to, again, have your family history, because for the screening guidelines for eligibility here at the bottom, age 50 if you're average risk, 45 if you've had a first-degree relative, meaning your brother or your father, 40 if you're even at higher risk if one of your first-degree relatives was diagnosed at an early age. So again, you want to talk to your physician about what's the right time to get screened for you. And then screening tests will look for possible signs of cancer, but they don't tell you for sure if you have cancer. So if your result of your screening test, the PSA, which is a blood test, is abnormal, you'll probably need a biopsy to know for sure if you had cancer. Then screening for colorectal cancer is for both men and women. Colorectal cancer will affect 150,000 US men and women every year. It's the 3rd most common cancer, but 2nd leading cause of cancer death. The rate of people being diagnosed with colorectal cancer each year has dropped overall because we have more people getting screened and we have improved lifestyle-related risk factors. The downward trend is mostly in older adults. Since 2012, the diagnosis rate has increased every year by 2% in people younger than 50 and 1% in 50 to 64. Screening can prevent cancer because the early detection and removal of what they call polyps, which are precancerous growths, and they can detect cancer in an early stage, again, when treatment is most successful. The slow course of growth from a precancerous polyp to invasive cancer provides a unique opportunity for the prevention and early detection of colorectal cancer. Here's the screening recommendations. Colonoscopy is the tier 1 recommendation. It is the gold standard. In cancer, when it's diagnosed in its earliest stages, also we can remove precancerous colon polyps. It's an opportunity to actually prevent colon cancer. The recommendation, if you have a colonoscopy and detect no abnormalities, is to have this screening every 10 years, starting at age 50. But because 10% of the diagnoses are occurring in people under the age of 50, some groups are now recommending starting earlier, even at age 45. Other tests involve sigmoidoscopies, or what they call a CT colonography, similar to a colonoscopy, but it will only look at the lower part of the colon. It uses very low dose radiation to visualize the inside of your colon, and the recommendation is to have this done every 5 years. There are also some home tests available for those who, for many different reasons, choose not to or are unable to do a colonoscopy. The Cologuard and Fit Kit are 2 types of those tests. However, again, this is a tier 3 recommendation. You have to do it more frequently. The colonoscopy remains the gold standard. These will detect tiny amounts of blood in the stool that could be a sign of colon cancer or larger polyps. Cologuard is done every 3 years. FitKit is every year. And like I said, with a positive result, you're going to have a diagnostic colonoscopy. So if you notice any changes to your bowel habits, contact your physician, even if you're not due or you've had a recent screening. And certainly if you have a personal or family history, talk to your healthcare provider about when to begin screening. How to schedule a colonoscopy? At Henry Ford, we have open access colonoscopy that lets you schedule a colonoscopy without the need for a pre-procedure visit to your physician. That means you only have to come in for one office visit, not two, and this will save you both time and money. So to see if you qualify for open access colonoscopy, here's the phone number on the screen, or you can call 8776-SCREEN, SCREEN, to get directed to our colonoscopy clinic. Another cancer that affects both men and women alike are lung cancer. It's estimated that 235,000 new cases of lung cancer will be diagnosed in 2021. Lung cancer is by far the leading cause of cancer death among both men and women. It makes up actually about 25% of all cancer deaths. Each year, more people are going to die from lung cancer than colon, breast, and prostate cancers combined. The causes of lung cancer include smoking, secondhand smoke, and exposure to certain toxins. And again, family history is important. Symptoms can include a cough, often with blood, chest pain, wheezing, and weight loss. These symptoms often don't appear until the cancer is advanced. Again, a reason to be screened. On a positive note, the number of new lung cases continues to decrease, partly because people are stopping smoking and advances in early detection and treatment. Another consideration for lung cancer is radon exposure. It is the second leading cause of lung cancer behind smoking. The Michigan Department of Environmental Quality lists 1 in 4 homes will exceed the recommended US EPA level of 4 per cubic liter. The radon tests are available at a local health department. The cost can vary, but your average, the short-term kits you can get for $11, and long-term test kits where you leave in your house for 3 to 12 months are approximately $30. Here's on the right-hand side, the map of Michigan that shows the red zone is higher radon has been found. The orange is medium level and the yellow is lower levels where it's acceptable. So I believe this is where we're talking about the West Bloomfield area in here. So how do you get screened for lung cancer? It's a low-dose CT scan that takes about 2 minutes to do. Every year, if you're a current or former smoker, or if you quit in the last 15 years and are ages 55 to 77, you have not had a CT in the past 12 months, you smoked 30 packs or more, and you show no signs of lung cancer currently. If you did have active signs, your physician would order a different kind of test, a diagnostic lung CT rather than a screening CT. This is, again, the gold standard for identifying lung cancer when it's earliest stages, when it's most treatable. Again, here's the signs and symptoms of lung cancer. So a cough that doesn't go away or gets worse, coughing up blood or rust-colored sputum, shortness of breath, unexplained weight loss or loss of appetite, if you're just generally feeling tired or weak, new onset of wheezing, and infections such as bronchitis and pneumonia that don't go away or keep coming back. So why should you get lung cancer screening? It's often diagnosed once it has spread outside the lungs. 9 out of every 10 people with lung cancer die from the disease because it is found after it's spread. If it's found early in screening when the tumor is located only in the lung, up to 63% of the people survive 5 years or more. And despite the very serious prognosis or outlook of lung cancer, some people with early stage cancers are actually cured. Here's some smoking cessation resources at the Henry Ford Health System. There's a web address. You can email us at tobaccofree@hfhs.org, or you can call the number here on the screen. If you live in the central region for Allegiance Health, which is Jackson and the surrounding counties, there's a different number to call. And then there's also the Michigan Tobacco Quit line listed here. Skin cancer is another cancer we need to concern ourselves with. Although we don't have a ton of sun in Michigan, there's enough that we go out without protection that exposes us to skin cancer. It is the #1 cancer diagnosis in the United States. It's more common than breast, prostate, and lung cancers combined. According to the American Academy of Dermatology, there's more than 3 million Americans affected by non-melanoma skin cancer a year. There's over 103,000 new cases of melanoma are estimated to be diagnosed in 2021. Melanoma is the most dangerous form of skin cancer. These cancerous growths develop when the unrepaired DNA damage to your skin cells will trigger a mutation or some kind of genetic defect that lead the skin cells to multiply rapidly and will form a malignant tumor. Melanoma accounts for only 1% of skin cancers, but causes a large majority of the skin cancer deaths. The majority of cases are caused by sun damage to your skin cells and largely are preventable. Anyone can get skin cancer, regardless of race or skin color. Most skin cancer is a result of exposure to ultraviolet radiation. The rays are strongest between 10 a.m. and 4 p.m. So we recommend that you use a broad spectrum water-resistant sunscreen that's at least SPF 30. And be aware that some medication can also cause sun sensitivity. I know the pictures on the right are small, but here's some pictures of abnormalities that you would want to be concerned and talk to your physician. So at home, once a month, check your body head to toe for any moles that have asymmetry. So one half doesn't match the other. The border edges kind of blend into the skin or irregular or notched, or a mole that has multiple colors or even shades of the same color. The diameter is greater than the size of a pencil eraser, or the lesion has high and low spots, so it's uneven and not flat. If you have a new growth or a sore that doesn't heal, or small, smooth, shiny, waxy lumps, get those looked at right away. And again, to lower your risk, protect yourself from exposure to UV radiation by staying in the shade, wearing a hat, using sunscreen or protective clothing, and sunglasses to protect your eyes. The good news is 90% is the 5-year survival rate for melanoma when detected and treated in its early stages. And then another interesting fact is the number 9. 9 is the amount of times more likely you are to detect melanoma on yourself or others if you are a woman. The reason is that men tend to be less aware of warning signs of skin cancer. Men are less likely to use sunscreen. Women tend to use makeup with SPF factor in it. And here's I thought this was really interesting, is that women's skin has more fat, which is actually a protective, where men's skin has more collagen and elastin, which makes it more susceptible to skin or sun damage. So here's reasons to get screened for disease early. We've all heard an ounce of prevention is worth the pound of cure, and it's easier to treat abnormal tissue, and it's going to not show any symptoms. By the time you have symptoms, it's much harder to treat. It would extend how long you live and improve your quality of life. And it does provide the opportunity to make lifestyle changes. And finally, tells your loved ones that you want to be there for them in the future by taking care of yourself. With the pandemic going on over the past year, more than a third of Americans have skipped their scheduled cancer screenings during the pandemic. The weekly cancer diagnosis fell by 50% for the top 6 types of cancer. And the National Cancer Institute is warning that drops in screening for breast and colon cancer alone may lead to as many as 10,000 additional deaths in the coming decade. So Henry Ford has put in place safety protocols to make sure that you can get your health care safely. We are scheduling appointments to allow for social distancing between patients. Every patient is screened for COVID-related symptoms before their screening appointments. We limit the visitors other than patients and their caregivers that are coming into our facilities. Everyone, including patients and staff, must wear a face covering or face mask. Of course, we have frequent hand washing and the use of hand sanitizer by the staff, the patients, and any visitors, and regular cleaning of all our patient care areas. And of course, we have our COVID vaccine clinics available for those to get vaccinated. And finally, how can I access any screenings? The top number on the left, the 8776 screen, you can call, and any one of these 6 screenings, we can facilitate an appointment at the appropriate provider for you to get screened. For women, you can also schedule your mammograms through mychart.hfhs.org. Now I would take any questions, and I thank you for spending time with me today to learn about appropriate cancer screenings. So is there any questions in the chat room?